We're going to discuss a vital topic, prostate cancer. This video covers everything from risk factors to prevention, symptoms to screening, survival rates to treatment options, and potential long-term effects. Stay tuned to empower yourself about one of the most common cancers affecting men. Prostate cancer begins in the prostate gland, which is responsible for fluid in semen and is located below the bladder. According to the American Cancer Society, 1 in 8 men will be diagnosed with prostate cancer in their lifetime, making the most common cancer and the second leading cause of death among men in the United States. Worldwide, it's estimated about 375,000 people died of prostate cancer in 2020. Several factors increases your risk of prostate cancer. Age. The chances of getting prostate cancer increases significantly above 40. Family history. Having a father or brother with prostate cancer more than doubles your risk. Race. African American men are more likely to be diagnosed with cancer, but also more likely to be diagnosed earlier and with more aggressive forms. Genetics. Mutations in certain genes like BRCA1 and BRCA2 elevate your risk. While no prevention is foolproof, certain lifestyle changes have been shown to reduce your cancer risk. Diet. Diet that's rich in fruits and vegetables and whole grains, and also low in saturated fats. Exercise. Regular exercise to reduce your weight has been shown to prevent advanced prostate cancer. Regular checkups, discussing screening tests with your doctor, and detecting cancer in an earlier stage when it's actually treatable can definitely help out. What about symptoms? Unfortunately, prostate cancer in the early stages doesn't have any noticeable signs. However, as the disease progresses, some men may experience some of these symptoms: difficulty urinating or have a weak stream, frequent urination, especially at nighttime, blood in the urine or semen, erectile dysfunction. You may also have pain in the pelvic area, hips, or low back. You also may experience unexplained weight loss. It's also important to note that some of these symptoms may also be related to non-cancerous conditions, such as BPH or prostate infection. If you do develop any of these types of symptoms, please make sure to bring it up to your healthcare provider for more guidance. Now for some good news. Prostate cancer has one of the highest survival rates among cancers. The 5-year survival rate is nearly 100% in men with local or regional disease. Early detection via screening using a PSA or a digital rectal exam plays a key role in these successful outcomes. Screening is the most critical aspect in prostate cancer care. The goal of screening is to detect cancer early before symptoms appear when it's most treatable. There are 2 common tests in prostate cancer screening. PSA test, or prostate-specific antigen test, is a protein that's produced by the prostate gland. It is the most common screening test that's used today. If the test is elevated, it could indicate prostate cancer, but also could be due to other types of prostate conditions. So when that test comes back, additional tests may be indicated. Currently, we're using the American Urological Association 2023 guidelines. In there, ages 70 plus, a PSA is not recommended, but please discuss this with your healthcare provider. For men of average risk, a baseline PSA is recommended between the ages of 45 to 50. After that, I will repeat a PSA every 2 to 4 years. A DRE, or a digital rectal exam, is optional for screening. If you do get a PSA that's elevated, I would also repeat that as well. For men that are higher risk, that will include men of African American descent, or if you have a first-degree relative like a father or brother, the actual screening age is earlier, between 40 and 45. The higher prevalence of prostate cancer in Black men is influenced by a combination of factors which include genetics, biological, socioeconomic, and healthcare access factors. The second most common test is a digital rectal exam, or a DRE. It's when a healthcare provider manually checks for any prostate abnormalities. Given that it's not the most common test, it's still a very helpful tool when combined with other factors. According to research, 25% of prostate cancer can be detected by digital rectal exam alone when the PSA was actually normal. Another helpful test is a prostate MRI. It's used when you have an abnormal screening or you want to detect different stages of prostate cancer. Treatment depends on many factors, including the stage of the cancer and the patient's overall health. Active surveillance, which includes monitoring of PSA over time, either every 6 months or every 1 year, can be very helpful. Surgery, which includes a radical prostatectomy, radiation therapy, hormone therapy, and even chemotherapy for advanced stages of prostate cancer. Long-term effects of prostate cancer treatment can include urinary continence and erectile dysfunction. Addressing these issues with your healthcare team is critical for managing your quality of life post-treatment. Thank you for joining me today. Understanding prostate cancer is the first step toward effective management and treatment. Remember, early detection can lead to successful outcomes. For more informative content, please subscribe to the channel and hit the notification bell. As usual, take care of yourself, take care of your family, and take care of your neighborhood. I'll see you next time.